When we talk about erectile function recovery after radical prostatectomy, we have actually nowadays several treatment options, such as PDE5 inhibitors. We have a possibility to use vacuum erection devices. We have other treatment options such as intracavernosal injections and surgery with penile prosthesis implantation. Age, as well as patient motivation, preoperative and baseline patient characteristics play a major role in the selection of the treatment we can provide to our patient. Obviously, younger patients and healthier patients and patients with better preoperative characteristics are the ones who should be treated and who should receive more aggressive approaches after the radical prostatectomy to recover erectile function. A well-performed neurovascular bundles preservation plays a major role. We also know that the introduction of novel technologies such as robot-assisted radical prostatectomy and other minimally invasive surgeries can improve our outcomes in terms of sexual and erectile function after surgery.
There is no optical management for Peyronie's disease being identified yet. Each case is very unique and individual. The management can vary from oral treatment to injection therapy, and at the end we may end up to a surgical intervention for the penile curvature repair. The incidence of Peyronie's disease is very low, only 3%. However, this percent is underreporting because for two things. First of all, the patients with mild symptoms, they don't seek for any advice or they don't go to any urologist. Secondly, quite high percentage of patients they feel embarrassing to go and discuss this. High percentage of patients, about 50%, they feel depressed about this situation. They feel uncomfortable. However, we have to make our best to inform these patients and make them to come and attend our consulting rooms. When a patient comes to us finally with Peyronie's disease, we have to treat the patient in a whole. That means that we should treat the disease, but at the same time to reach and treat the psychological aspects that this disease can affect to the patient.
Active surveillance is an increasingly used option in selected and very selected patients with prostate cancer. We should always remember that the primary goal of treatment in prostate cancer patients is to cure the disease. However, when we have a possibility to delay or to avoid this treatment because a patient has a so-called indolent prostate cancer, actually active surveillance might play a major role and can have benefits also in terms of postoperative, let's say, reducing the risk of postoperative complications.